Welcome back to our bigger picture discussion of healthcare in America. With me tonight, Ethan Rome, Karen Davenport, Ron Pollock. Thank you all for being with us tonight. Ethan, paying for this, where does the funding come from? How do we make sure that the funding is there? How do we make sure that we don't get 2, 3, 4 years down the road, the administration changes, the Republicans take control of the House, pull the rug out? I mean, what's the mechanism here?
I mean, the law paid for itself, and in fact, it created a budget. It contributed to reducing the budget deficit. The fight that's going on right now that relates to how we pay for health care is the fight to defend Medicare and Medicaid in the so-called fiscal cliff discussions, the budget debate. There's this huge debate
this week and next week.
Right,
and the weekend.
This week, right here in Washington, we are all hepped up about the so-called fiscal cliff, the fiscal curve, the showdown, whatever you want to call it. It's a debate over priorities. It's a debate about what we want our country to be. And for those of us who support Medicare and Medicaid, who believe that health care is something that everyone ought to have, it starts with having the wealthiest people in this country contribute their fair share in taxes. And unfortunately, the Republicans have been drawing a line in the sand. And it makes no sense. It makes no sense at all. And so it's just so critical, not just for the Affordable Care Act, but for Medicare and Medicaid, for health care, for people with disabilities, for the elderly, for all of us. And that's why we're very, very confident, and the President has made it quite clear that he is going to stand firm, and he's going to insist on revenue, and he's going to stand up for these programs.
Karen is the Director of Health Policy for the National Women's Law Center. How does this affect women and families? And how is it going to be different 2 years from now than it is now, and how is it going to be different 2 years after that?
Well, the immediate issues around the budget debate, women have a lot of stake in, because not only are programs like Medicaid and Medicare that are so important to women's health care, potentially open for negotiation, but programs that support child care and enabling women to get higher education and improve their family's financial security, all of those kind of programs are at risk too. And that's why, like Ethan, we think that having the new revenues being part of the mix is such an important piece. But stepping back and looking at how does healthcare reform end up helping women, it already is. Women are able to access preventive services like mammograms and contraception without co-payments. When the full flower of the law is implemented in 2014, the kind of benefits that plans will need to offer include maternity benefits, which are not very easy to find in the individual market these days, and so that is something that every woman will be able to have covered. The kind of financial costs that families look at in terms of their health care, it's just going to really change in terms of what's covered and how much they have to pay out of pocket for the services they really need.
Okay, thank you. Ron, we were talking about the politics of this before we started on, touched on this topic. How do you see this playing out over the short term and over the long term politically?
Well, in the short term, I think the real battle is going to be on revenues. And the President campaigned very clearly that he thought that the wealthy should contribute a portion of what is needed to get us better in balance. I think the President's going to win that battle. I think the President is not going to yield on that battle. So I think that'll be the short-term battle with the cliff. In effect, the President is saying, let me move forward and continue to provide tax cuts for middle-class families. But don't hold hostage the need that I have to do this for the wealthiest families. And I think the President's going to win that. By the way, if Congress does nothing, then all the tax cuts are ended, and so it'll hurt middle-class families. After that happens, then there's going to be a real budget fight, and what we have looming is that the debt ceiling is going to have to be raised. And I think that's when you're going to have most of the bargaining. And, the Republicans in the House last time really tried to decimate the Medicaid program. What Congressman Ryan, chairman of the Budget Committee, tried to do is to cut the Medicaid program by $1.5 trillion over 10 years. more than, I think you can take any 6 programs in the country and combine them, and the cuts that he proposed would not equal the cuts that he proposed in the Medicaid program. And of course, he wanted to restructure the Medicare program. The president has been...
Voucherize it.
Yeah, yes, and you know, he wanted to make it a voucher-type program. Those things are not going to happen. And the president was really clear about where he stands on those things. And, you know, elections mean something. And I think those things are not going to happen. I think the president is going to stand firm. And I think we're going to wind up having a deal that is going to protect these health care programs.
Yeah. Let's hope so. You know, from your lips to God's ears, we'll see. Karen, Vermont. I lived in Vermont for 10 years. I have a great affection for the state. And they passed through their legislature a single-payer health care system. This was like a year and a half ago. Passed it. Governor Peter Shumlin actually campaigned for governor on, if this gets passed, I will sign it. Won the governorship, signed the bill. Is it 2014 or 2016 that the waivers kick in and that allow the states to do this? And is this the crack, you know, the door cracking open to the first major expansion or transition of this program?
Well, I think it's either 2016 or 2018. I'm looking for backup here from my colleagues. The state waivers to do something very different come in a couple of years after the full implementation of the Affordable Care Act. You know, I think it'll be fascinating to see what Vermont does and how a couple of other states move forward in terms of redesigning their whole state programs and looking at single payer. My personal view is that we have taken such a big step with the Affordable Care Act. We tend to sort of move more in a more evolutionary manner in our healthcare system than to make those kind of big changes, and they will show us if we can take that kind of big step, and then we'll see where it goes.
So, Tom, you and I have talked about this on previous occasions.
Yes.
It's not an easy thing in this country to move towards a single-payer system. In fact, when the Affordable Care Act was being debated, and you had Democrats in control of the House and the Senate, it was even difficult, and it wound up not being included, having a public plan option.
Well, arguably, Democrats weren't in control of the Senate at that point. When this passed, Scott Brown had been sworn in, and so there was not a filibuster.
Yeah, but even before that, even before Scott Brown was elected, this passed the Senate actually on 3 different occasions before Scott Brown was elected, and a public plan option could not pass the Senate. I think our big challenge right now is to make sure that the Affordable Care Act is implemented effectively.
Just as it is. Just, make this thing work.
Let's build confidence about this. And the most important thing is let's make sure that the tens of millions of people who don't have coverage today actually get enrolled. And so that's going to require a huge public education campaign, and it has to be run like a campaign so that the people who can benefit from it actually know about it and then get enrolled.
Ethan, there's, the pushback is, you're giving people gifts. It's healthcare, it's a gift. We can't have that. And there's all these new taxes, 6 taxes, 18 taxes, 312 all these different numbers. How do you respond to those?
Well, here's the thing. Obviously after the whole campaign, what's really, really clear is that there was 2 candidates, one of whom campaigned to rebuild the middle class and one of whom didn't. One of whom believed in the middle class and the other of whom talked about a slacker class. Yeah. And so the middle class won. And when it comes to all of the debate about this law has been totally political. I've never met an uninsured person who says, I don't like this law, it's too complicated. Right? It just doesn't happen. Yeah. Right? And so, and small businesses that are struggling with healthcare costs, that actually provide healthcare for their employees, are excited about this law. So, I'm with Ron and Karen. We need to keep our eye on the prize right now. Implementing this law. 35 million people get health insurance. Medicare, Medicaid gets stronger. Right? We improve care. We get better outcomes. That's what this is about, and depoliticize it. right? It's, you know, we're just a little few days after the election. What our point with everybody is, let's just stick with policy for a few minutes and not talk about politics.
Well, speaking of that, Ron, are there going to be enough doctors and nurses? This is another one of the things that was brought up in the debates. You know, if you give everybody health care, then everybody's going to show up at the doctor's office and the system will break down.
Well, we already have, particularly in certain areas, particularly rural areas, we have a shortage of physicians. Affordable Care Act tries to improve upon that. It's going to be an incremental improvement. There are going to be somewhat improved payments to primary care doctors. Those are the doctors we really have, those are the folks we have to encourage.
Yeah.
We need more primary care doctors. You know, if you compare the United States to other countries, one of the glaring differences is the ratio of specialists versus primary care doctors, and we have a much higher ratio of specialists. We need to have a whole lot more primary care doctors, and we're going to move in that direction. Is it going to happen overnight? Is it going to be quick enough? And, you know, it's going to be incremental, but it is going to be an improvement over time.
Yeah. Karen, do you expect that? I've been watching this British TV series called Doc Martin, and it's about a little country doctor, you know, and he does everything. I mean, he does everything. He delivers babies, he stitches people, he does things that, you know, here in America, people would always send it out to a specialist. Do you think that the nature, in the minute we have left here, that the nature of medicine in the United States is going to change as a consequence of the Affordable Care Act?
Well, I suppose in some ways, what I think we'll see are not so much that solo practitioner doing everything, but, you know, continue to see more physicians working together, and to see you know, people like physician assistants and nurse practitioners really providing a lot of frontline care too. But in the most important way, I think we're going to be seeing people who today don't have health insurance but have, you know, chronic illnesses like diabetes and heart disease. They're going to be able to get the care they need to manage those diseases and to live better and fuller lives. And that's the kind of improvement we're all really looking for.
Critical and important stuff. Ron, Karen, Ethan, thank you all so much for being with us.
Thanks for inviting us.
It's a great conversation. To see this bigger picture discussion again, or to see any of our Conversations with Great Minds, go to our website, conversationswithgreatminds.com. Coming up, do Republicans really want to know the truth about the Benghazi consulate attacks? Or is their witch hunt just another way to score political points? That and more in tonight's Big Picture Rumble.
You know how sometimes you see a story and it seems so whole and complete, you think you understand it, and then you glimpse something else. You hear or see some other part of it and realize everything you thought you knew, you don't know? I'm Tom Hartman. Welcome to The Big Picture.
It's Friday. Are you ready to rumble? Joining me for tonight's Big Picture Rumble, Horace Cooper, conservative commentator, Neil Monroe, White House correspondent with the Daily Caller, and Sam Sachs, progressive commentator and contributor to truthout.org. Thank you all for joining me. Let's get into this. Let's start with Benghazi. Former CIA director, very recently former CIA director. That's a whole other thing, I suppose. David Petraeus testified on Capitol Hill today about Benghazi. I don't know if John McCain showed up for this one. He missed the one yesterday. But in any case, he confirmed that the attack was indeed an act of terrorism, consistent with what President Obama had said in the Rose Garden the day after the attack. Here's the clip.
No acts of terror will ever shake the resolve of this great nation, alter that character, or eclipse the light of the values that we stand for. Today we mourn for more Americans who represent the very best of the United States of America. We will not waver in our commitment to see that justice is done for this terrible act.
Republicans John McCain and Lindsey Graham have been calling for Watergate scale or type investigations into Benghazi. Yet both McCain and Graham skipped the hearing yesterday where the Joint Chiefs and the FBI and the CIA and everybody else came to tell the senators what they wanted to hear. So my question, and let me start with you, Horace, are Republicans really serious about finding out what's going on, what happened in Benghazi, or is this all just, you know, like pulling on Whitewater and, oh, let's pull on Rose Travelgate and let's pull, you know, let's find something that we can impeach this guy about?
Well, first of all, Whitewater ended up being a very, very serious issue. Even the Attorney General of the United States
lost $30,000.
Even the Attorney General of the United States recognized the seriousness of it. But let's not relitigate that. Let's point to this particular issue. It's poppycock to say that that particular speech represents the president's statement and beliefs about the matter, when in fact 60